Hello, listeners. Hope you're having a great day today. I'm excited today. I'm always excited when I do podcasts. It seems to be an ongoing theme. We are at Communicamp and doing some live podcasts today. And today I have the honor to be with Dr. Jenna Blum.
Hello.
How are you?
I'm good. How are you?
I'm good. As we're doing this, they're doing the parent panel and child panel where past families are sharing their experiences and kind of discussing their journey for treatment of their child or teen, or the teen is sharing their journey. And one thing that stands out that I don't think people realize as much as they need to realize is that as much as a family will come for treatment for their child to overcome selective mutism, I don't think they realize the importance of parenting. Mm-hmm. Not to the level that they really need to understand. Do you agree with that?
Yeah. I definitely get a lot of people say, okay, so Communicamp is just a time where my child gets to work on strategies. What time do I pick them up? And we always explain when we talk about Communicamp that the parent panel or the parent portion of the group is just, honestly, I don't want to say it's the most important, but it's definitely a very, very important piece of Communicamp.
Right, absolutely. We do all-day parent education, like 16 hours of it with Communicamp.
Yeah.
But in general, with treatment of children with selective mutism, teens with selective mutism, there are families that are used to seeing professionals, let's say, that they go for therapy once a week. The child goes into the therapist room. Parents are sitting out in the waiting room. They're on their phone. Mm-hmm. They're reading. Session's over and they leave. Mm-hmm. Child comes back the following week. And I am so passionate about parent education and that whole person approach of really involving the parents. And I think this is critical. And so today I want to talk about how parenting styles affect the treatment of children with selective mutism. I really, really want to talk about that. Mm-hmm. So let's start. There's 4 types of parenting, right, Jenna? We're going to get right into it. How's that?
Okay. Sounds good.
So why don't we talk about the different types of parenting, and then what we're going to do is we're going to kind of talk about how it affects treatment, the different types, and then we're going to go into with the specific type that we recommend, and obviously everyone recommends, authoritative parenting, which you're going to talk about. How do we become more authoritative in terms of parenting?
Yeah.
So why don't we start with that? So why don't you share the different types of parenting and kind of a brief explanation of each of those parenting? That would be awesome.
Sure. Yeah. So there are 4 different types of parenting styles. And the way that I always like to explain it is there's almost 2 ingredients to parenting that we like to kind of differentiate. So we think about control, and then we also think about warmth. Those are kind of the 2 pieces. So warmth being someone who's really affectionate, maybe there's emotional connection, control being very maybe rigid, or there's a lot of structure. So control and warmth can look very different. But when we think about the 4 different parenting styles, there's going to be different levels of the control and warmth in each of those parenting styles. So for permissive parenting, that's our first type of parenting. That's a parent that has really high warmth, but there's not as much control. So these are typically parents that allow their child to almost be the boss, or they allow their child to be the parent in the household. Yeah, whatever you want to do. Or this might be a parent that when we think about like bedtime routine, their child chooses the bedtime routine, right? So this is a child that very much has the control in the house. There's very little control that a parent's providing, but there's a lot of warmth there, right? Then there is the authoritarian parents. And so this is actually a parent that's almost like the complete opposite. So this is a parent that has very high control, but very little warmth. So this is a parent that
kind of my way is the highway.
Yeah, I would say that, like a parent that very much has very rigid, this is what it has to be, doesn't really listen to their child. If their child has something that they need to ask their parent, it's very much like, well, this is just what it is, right? And there's very little areas of understanding in that capacity. It's very much like, I'm the parent, so this is what it is. So in this case, when we think about like bedtime routine, for example, it's like your bedtime routine is 9:00. Maybe they didn't provide their child with any warning, and then that's just what it is. So that's authoritarian. And then there's also an uninvolved parent, which is where there's actually very little control or warmth. So this is just a parent that's very uninvolved. Many times that could be either they're physically absent, so maybe they're just not in the household, but it can actually be a parent that's also emotionally absent. So it could be a parent that is in the household, but just isn't emotionally there. Their child needs them, they're seeking them, and their parent is maybe watching TV, or they're just very uninvolved in that way.
On their phones.
On their phones. That's a big one. So it's very much like you're on your own. You can handle it. So many times these kids feel a little bit out of control. And then I would say the last type of parenting, which obviously is what we're going to probably focus on the most today, is authoritative parents. So it's authoritative parents, when we think about control and we also think about warmth, these are parents that provide high levels of both. So it's parents that very much will say to a child, let's talk about it. Like, I see that we're kind of struggling a little bit. Let's talk about it. Let's really try to get a deeper sense of what's going on. But they're also still providing structure and consistency and predictability and all of those things at the same time. So if we're thinking about like a bedtime routine, for example, this might be a parent that they might talk to their child about, let's create a bedtime routine together. Let's talk about what your nighttime routine looks like. Your bedtime is still 9 o'clock. We want to make sure that you're ready for school the next day, but let's have you check it off and let's talk about it. So they're very much still providing control. They're saying you do have that bedtime routine, but there's also warmth that kind of goes within that.
So one of the things that would be great to talk about is to give a couple examples. Mm-hmm. So you did a great explanation of this, and I'd like to give some examples. Like when you were talking about, let's talk about maybe eating, like having dinner together.
Yeah.
So, and we can talk about even just kind of discipline and how you handle that. And then I want to touch on what happens when you have two different types of parenting styles, raising a child, and how that's so confusing.
Definitely.
Whether it's in the household or divorced or separated parents.
Yeah.
So these are challenges that truly affect treatment.
Yeah.
So let's talk about, you started out talking about the permissive parent.
Yes.
So I see this in my office. I see families come in where the child can be a little bit disrespectful. The parents don't have the disciplinary measures in place. Mm-hmm. And we're going to talk about how that affects treatment in a bit. But basically when it comes to something like eating, like we love to think about families eating together. This is where the parents are, let's say they're making chicken and pasta and green beans, and that's the meal for today. But the child just doesn't want that. So the child will just kind of pick what they want. The parents working really hard to make their special meal because they don't want the chicken. They don't like the chicken. It's not tasteful to them. So it's not talked about it, but the child just makes the decision. Mm-hmm. Or to the extent of, okay, we're not going to have chicken today. We're going to have whatever you want today. Mm-hmm. So it's like whatever the child wants, they're ruling the nest.
Yes.
And then you have the authoritarian parent, because I think you said that next. That's it's my way or the highway parent.
Yep.
That's when it's chicken, pasta, and beans, maybe said in a nice way, but that's what you're going to eat. If you don't eat that, but go in the other room. That's what we're having.
Right. Child
kind of feels like kind of disrespected, kind of feels like, wait, I don't like chicken.
Right.
And especially if many of our kids are sensory kids, they can't eat the chicken. It doesn't taste good. They don't like it. So, but that's what you're eating. So basically, if you don't eat that, you don't eat tonight, or you'll eat later when you have your snack. And then we talked about the uninvolved parent, where it may not even be around, like dinners whenever.
Right. Right.
Say that's.
Yeah, it could be, like I said, uninvolved is a very interesting type of parenting, because so many times parents feel like, well, I can't be an uninvolved parent because I'm in the home all the time. But there's also the difference between, like I said, the physical and emotional uninvolvement. And children feel that. So this could be a parent that, again, is in the household, but maybe they just leave money on the table and they're like, all right, figure out your dinner. I'm just going to be sitting in the other room. I have work to do. And so the child, again, even though the parent's in the household, they still feel that neglect. They still feel like they're almost, in a way, I know this sounds like a strong word, but almost abandoned in a way of like, I don't know who to turn to. I'm just eating by myself. So that's what I would say is more of the uninvolved.
Yeah. And then we talked about authoritative. This is the family that's more responsive. Let's talk about it. Reciprocal, clearer standards and understanding, mm-hmm. but they set the boundaries. So here's how I describe it in terms of eating. The child isn't comfortable with the chicken, doesn't like the chicken, doesn't like the pasta. That's not a great meal. Have alternative meals. Mm-hmm. Maybe the child likes chicken nuggets, but they can't eat the grilled chicken. or they're hamburger kids, or they're pizza kids, nutritious. So you have like 3 or 4 options,
Yep.
knowing that child may be a sensitive kid, but they're involved in preparing that meal to help. So it's not just on mom or dad to make it all happen.
Right.
It's, okay, you don't want chicken, we prepare it, we talk about it in advance. You're not going to eat chicken. I know that's one of the foods you're not a great lover of, but mom, dad, sister, brother, we love that. So why don't you pick one of your alternative meals?
Yeah. I actually think that's a great example, because I think so many times I have parents that will say to me, I don't want to give my child too much choice because then I'm worried I'm going to become like a permissive parent where the child then takes over. And I always explain, again, when we think about the combination, right, those 2 ingredients like control and also warmth, is there, it's okay to give your child choices. It's okay to allow your child to be part of that process. But like you said, you still set some of those boundaries. So it's not, all right, you know what? You choose whatever we're going to do. It's, as a family, let's make a decision. I'm going to say we're going to have, like you said, we're going to have chicken, pasta, or this. You tell me, out of the chicken, do you want chicken nuggets or do you want maybe like chicken thighs or something like that? And the child says chicken nuggets, right? So you're still setting the boundary as a parent of, this is what our meal is going to look like.
Right. They're not,
but you're giving choices.
They can't have a hot fudge sundae for dinner.
No, I mean, I would love that. Honestly,
too.
that would be very fun. But I did. Well, and I think that's why I'm so passionate about it, because I definitely had I remember as a child, like there were times where I had mac and cheese when everyone else was eating something, because I was a picky eater. I remember being like that, but I do remember always having like different choices. It wasn't like, oh, I'm just going to eat whatever I want. It was very much, let's make that decision together. And I think it made it more effective because the child feels like they're in control, but also a parent has those strict boundaries at the same time.
Yeah. So these are like really good examples, and we can go on and on. I'm going to give an example of maybe a permissive parent. Let's say you're going to a movie or you're at a function, and you're at the function, you're looking forward to the function, and the child at the function, no specific reason other than they just wanted to leave. The parent says, we're there, and the child turns to the parent and goes, I want to leave. Parent's like, really? Yeah, I want to leave. Permissive parent goes, okay, let's leave, without thinking about their own needs.
Right.
And also feeding too much into the child's wants.
Right. It's like the child has the full control. Right.
The authoritarian, which is my way or the highway, the parent rises up, you know what, I don't want to miss a show on TV, or I'm going to make a couple calls, or I have an exercise, I'm going to do it now. I don't really love this show. And the parent goes, come on, let's go. And the child was really invested in that, didn't want to leave. So the parent kind of pulls them out. Right. Instead of the permissive, you see what I mean? Yeah. And then, of course, the uninvolved may not even have been at the show. Yeah. But, or if they were sitting on their phone, not even thinking about their child's needs at the moment, but only their needs. But then there's the authoritative parent that might say to the child that says, I want to leave. So the child wants to leave. Wait a minute, honey, I'm watching this show. I really want to finish watching this show. We have about 20 more minutes. Like, it's important that this was something we were supposed to do. I don't want to get up and leave. Right. And so I'm saying this example because I've seen this happen.
Yeah. And it could be like, for example, let's say it's a sensory sensitive child, right? They have selective mutism. They're at an event. It could be planning beforehand. Like, you know, I might realize that my child might get really overwhelmed. They might be overstimulated in some of these environments. So maybe the parent brings 2 or 3 like fidgets or self-soothing things that, or like earbuds or something like that, that could be helpful. And then when the child might say, Mommy, I'm feeling a little overwhelmed, I need to go right now. Parent says, listen, we only have a few minutes left. Right. I obviously acknowledge that. I want to be here for you. But remember, we prepared for this. Do you want the earbuds or do you want your fidget toy? Right. And maybe then they give their child that control. We transfer that control, but the parent's still saying, no, it's important that we stay, but why don't I help you? And why don't I, again, give that emotional support by having you choose those 2 options. So that's what I would say would be a good example for.
Yeah, no, that's a great example. I love that example. And also maybe choosing seats that aren't right under the speaker.
Exactly. So, and I know you mentioned this a lot, and we do this with a lot of our patients, is like, why don't we talk about what would be most effective? So even before we go to an event, let's think about what are the things that will allow us to succeed the most. Maybe it's, all right, I know I have a child that gets very overwhelmed. Maybe I sit in the back corner because I know that there might be a time where we might need less of that volume, or so there's different ways that we can like.
And of course, based on the age, a 3-year-old
of
is
course,
a logical conversation. but the parent isn't advanced. This is why
Yeah.
the whys are so important, because we have so many sensory kids.
Definitely.
We have kids that have some auditory processing difficulties. So they're at a show, and it's a lot of talking and they can't follow it.
Yeah.
This frustrates the child. They may act out. They may shut down. So it's really understanding that child in these settings and what may affect them to behave in a certain way or to act in a certain way. And we start to figure out what triggered that child to act a certain way. And that's how some of the ways that we figure out our parenting.
Yeah.
What caused them to act out or shut down.
Right.
And you kind of look at those triggers and then you kind of work through that. It would be really great to kind of talk about treatment itself.
Yeah.
Again, parent comes, treat their child, help cure my child of selective mutism. Okay, we're going to help your child build the coping skills to combat their anxiety. However, we need to work with you to train you, not only how to implement strategies, how to understand the bridge, how to bridge up, how to bridge down, but let's talk about how you parent.
Yeah.
And that's critical. And it's so often a literally ignored topic in treatment.
Yeah.
And you see some of these families where these parenting styles are just so off.
Yeah.
And you got to work with it because they're not going to be able to overcome it, the children, if parenting is not worked on. So let's talk about the different parenting styles and how it affects treatment, at least what I see. Now, this is not in the research.
Yeah. Although I will say one thing that's really important, and I know we have a lot of like younger family listeners that listen to us, but I will say, I do think I work a lot with teenagers, some young adults. I think when we're thinking about parenting, of course, we have to be age appropriate. We have to think about what would help the child the most. And each case is different. But my dissertation was on parenting, and I actually worked with college students. And I did find, like, in the research that even as old as 18 to 24-year-olds, parenting was still super crucial, right? Like parent involvement. So I think this could be really effective for all ages, right? When we think about parent involvement in treatment. And of course, again, it could look different, but I do think that as we're talking, this also can be for some like teenagers and young adults.
Those are good points. So as we explain to families that the younger the child, the more involved the parent is in terms of the strategies and the interventions to be able to set the world up for them, what I call the silent goals, setting up the play dates, setting up the small groups in class. The teachers are doing that, facilitating certain games and activities during get-togethers, knowing how to prompt them at restaurants with the visuals and the way you ask questions. The parents are very key in facilitation, and they're playing the games that the parents are facilitating. As the child ages, it becomes very goal-like. It becomes much more cognitive. Cognitive behavioral therapy is involved in that, right? The exposures are critical. We're really, really working with the child as they get older and into the teenage years, where they're so actively involved in their games, their goals rather, their goal setting, and working with their motivational level and things like that. But their parenting behind the scenes as how they parent that teen is just as important as if they were 3. They may be more involved in their goal setting and creating their charts. So I want the audience to be really clear with that. But the parenting is so critical.
Definitely.
In all ages. So that's across the board.
Yep. And like you said, parenting could look different, right? It could not be having to like hold my child's hand and pick them up when I'm going out and about, but it could be still unlearning some of those conditioned behaviors for some of our teen parents. So there's a lot of parent involvement, but again, like you said, it could look different depending on the age.
And so to get back to how it affects treatment and where I was talking about like the research piece, I have not yet seen any research on this particular aspect to SM. How does parenting styles affect treatment in terms of how they present?
Yeah.
And so I think this is like fresh to a lot of these families in terms of like, oh, this is kind of interesting. This is my child. You know what? I definitely need to work with my clinician on help me learning and reading additional resources on how to parent my child in a different way to kind of help your child along in this process. So I'm excited to get your thoughts on this because again, like you did your dissertation on some of this in terms of parenting effect and so forth. So let's talk about how it presents. How's that?
Yeah.
So we talked originally about the permissive parent. That was the first type of parenting that we talked about and you described. So again, just summarize again, permissive parenting.
Yeah. So again, if we think about those 2 ingredients, right? So permissive parents are parents that provide a lot of high emotional support right? But there's very little control. So these are typically parents that the child is like, I'm just going to make the rules. I'm just going to do it. I want. And the parents very much emotional, like, yes, yes. Like
Go
whatever
do
you
it.
need.
I love you so much.
Exactly.
Give me a kiss before you do it.
Exactly.
But they're kind of like, it's like the child is ruling the nest.
Exactly.
Right? The child is ruling the nest,
Yep.
and the parents are in the background in terms of they're involved. They're over involved in a lot of ways.
Yeah. I always think of it as like a parent's your best friend. And there's like so many great values to that. But this is just like, I view my parent as my friend. I don't view them as someone who also sets the rules for what I need to do. So they might treat them like a friend. They might be like, yep, we're just going to do this. But it's like, no, your parent is still the one that has that structure and that consistency in the household. So yeah, permissive parents are definitely much, I'm just going to allow you to do what you want to do.
And I will talk about that whole best friend thing in a little bit. So I don't want to divert too much, but let's talk about permissive in terms of how it affects. So here's how I see it. I see a child or teen present where they don't care. They kind of lack internal motivation for change because it doesn't really matter. My parents are going to be like doing for me, or I can kind of do what I want. And I see this kind of doesn't care attitude. They lack internal motivation for change. They can also be kind of disrespectful to their parents.
Yeah.
These are some of the kids I see in the office that will talk rude to their parents. They're disrespectful.
Yeah.
They may hit their parent.
Yeah. I actually have found that sometimes these are actually even families where it's like, we might get a call at the office and they might say, sorry, but Billy's not available today for his treatment. And then I'll find out later. He just told his mom, like, I just don't really feel like going right now. And so mom's like, all right, you're right. Like, let's just call and say that this is not a good day, without even thinking about the fact that, again, that structure, that predictability, the importance of providing the structure of treatment. Right. But like, again, like he's kind of owning that treatment. And we have to think about age, right? With teenagers, a lot of times we want them to take a lot of that control. But again, we want to think about the importance of how, if you're just like telling your parent, like, yep, I'm just not going to show up right now. Or even in school, right? With that school refusal, it's like, yep, I'm just not going to go to school today. And parents like, yep, you're right. I'll just call out. Again, there's times where we might need an R&R day. That's important, right? We might be sensory sensitive and we might get overstimulated sometimes. But if that's frequently happening, we're obviously not going to learn a lot in school if we're not showing up. So I think it's important to really think about how this really can slow down the treatment process.
Yeah. And I just want to be clear because we talk about school refusal and that's another podcast in itself.
Yeah.
But I want the listeners to understand that you're saying that more in like a general, I don't want to go to school way, not in a true school refusal case, that there's so much anxiety and maybe they have just such anxiety from learning challenges and they're not feeling good with peers. And there's a real true debilitating dysfunctional aspect. So I want our listeners to know that we're not talking about that school refusal, more of like, I just don't want to go to school today.
Right. Like kind of exactly. I'm thinking of more just like a general sense of like a child just kind of wakes up in the morning and is like, Mom, I'm just not going to school today. And instead of like the parent kind of sitting down with the child, like an authoritative parent and kind of talking to the child about those difficulties, the child just says, yep, not going and going back to bed. And then they don't really have that conversation.
So it's the child that just doesn't adhere to kind of the structure, consistency, routine, predictability, because there really isn't any. There's a lot of inconsistencies at home. And what I see with kids in treatment is they just don't necessarily, not even if the parent is presenting the games or the goals, they just don't want to do it that day.
Yeah.
Instead of saying, hey, we need to do this many exposures and we can do it now or we can do it this time. But that's not there. Well, that's authoritative. I get that. But it's very inconsistent. They lack structure to their games, their goals. It's very lackadaisical. And I don't have to do that. There's really no reason. There's no ramifications. And what I find is that the child feels completely kind of out of control with the permissive parenting. Would you agree? Like there's so little structure, consistency, routine, and predictability, which our kids crave. And so much of SCAT is giving control to those children in a very kind of structured, you know what, when, and where, that when they don't have that at all, the treatment is so inconsistent.
Yeah.
And that's how their parenting is. So why would it be any different with the child's view of games and goals and things they need to do? Of course, age related.
Yeah.
And so the treatment is slower, Jenna. The treatment is slower.
Yeah. I would actually say, and I mean, this is a very like family systems way of thinking about it. But when we think about a family, right? Having control in a family is so important. So if we think about a parent that's not controlling at all, well, someone has to build that control into the house. So that's where the permissive child, I feel like, or a permissive parent will then have a child that controls completely because they need to balance it in some way. So it's like there is still control, but it's not the control that's allowing the family to like strive, right? Or like thrive in that way. So it's a little bit imbalanced in that way.
Yeah. So these are the parents that, and that's a really good way to look at it, because it's almost like you think of a seesaw.
Yeah.
Right? A seesaw.
Right.
Heavier in one way, lighter.
Yeah. And every family should have an even seesaw, right? Like there should be, like, let's say a parent's on one side and a child's on one side. That's why I think authoritative parenting is so successful, because if you think about like even emotion and control on one side, it's so evenly split. So it's like a child just feels so balanced.
Right.
Yeah.
Would you say that works with warmth and control too?
Yeah.
Seesaw?
That's what I was saying. Like, I think sometimes even having like, instead of like the parent and child on one side, let's say warmth on one side and then control on one side, and having that so evenly split and weighed down, I think a child feels so much more balanced.
Yeah, I do too. And they're going to manifest some of this with behaviors.
Yeah.
And lack thereof.
Exactly.
And I think, and what I want listeners to understand is that we get that you may not know how, and that's where your clinician can really help you.
Exactly. And I think, like you said at the beginning, we're talking about this in such a generalized standpoint, but of course there's always unique aspects that we have to tackle in individualized treatment. But this is just more of like a general sense of what we find with parenting styles.
So we talk about the uninvolved parent. Okay. Let's talk about the uninvolved parent. This is, again, summarize uninvolved again.
So again, if we're thinking about the ingredients of control and warmth, this is a parent that really lacks both the control and warmth. It's very low on both ends. So this might be a parent that is either physically uninvolved, like they're just not in the household, or it could be a parent that's very emotionally uninvolved, like they're just sitting in the den on their phone constantly, and so a child's not really getting a lot of that guidance.
So let me play devil's advocate. Okay. You have a parent that is struggling to make ends meet, especially now with the way the economy is, right?
Yeah.
They're struggling to make ends meet. They've got to work. So they're not in the house. So let's be clear to our listeners that there may be somebody else in the home, like a babysitter or a grandparent, somebody that's helping raise those children. They have to instill that structure, consistency, routine, and predictability.
Yeah, exactly. And I think, right. And that could be a whole other podcast. So I think it's important to understand, like, of course, every family has their own unique challenges. And again, those are things we can work through in individualized treatment. I think what's important, though, is that a child still needs that warmth and control. And I think that there's actually even previous research that's found that it's not even necessarily just coming from that initial caregiver. It could be, honestly, like you said, it could be an aunt, it could be a cousin, it could be an older sibling, even in some ways. It could be a grandmother. It could even be, like you said.
I'm bringing up grandmother for a reason, right?
Well, I'm not pregnant, if that's what the listeners are thinking.
But one day I'll be a grandma.
Yes, yeah.
So I
just had to make that very clear, because I am your daughter. So when you said that, I was like, why are you saying grandma right now? But yeah, no, I do think that it's more about, actually, a caregiver can be a very broad topic, right? It doesn't have to just be a parent. But again, this is important for parents to hear.
So for the uninvolved parent, the child often feels lost, confused, often alone in their feelings. They also tend, similar to a permissive, to be kind of disrespectful.
Yeah.
They ignore their parent. They just lack empathy towards their parent, similar to permissive.
Right.
So as far as how they treat their parent, I find the uninvolved parent, the child is just also has that disrespectful. They're almost PO'd.
Yeah. Yeah. I mean, I think, honestly, if we're using like the seesaw analogy, it's almost like someone with permissive, right? It's like the warmth is completely weighing it down. And so the control piece is like kind of out of sorts. So that's where the child has to like push the control down. I would say with uninvolved, the seesaw is kind of broken, right? There's really not any way for the child to feel that control at all. And there's not any emotional support for them to feel like, okay, let's fix this together. So they're feeling very much like, how do I even get on the seesaw?
And so would you say that all parents have a little bit of everything? And when we're talking about being an uninvolved parent, I get life is tough, right? And some parents are like, well, I'm doing the best I can.
Yeah.
And so we want parents to understand we're not thinking all the time, but if the majority of your parenting, even if you're working full time, because it's quality over quantity.
Exactly.
And if you have more of an uninvolved way, and it could be one parent versus another,
Yeah.
so the child acts differently towards that other parent.
Right.
And that's also very confusing to parents. Why is my child different with me than their partner is?
Yeah.
And so that's important for our listeners to hear and talk about through therapy as well.
Yeah. And I do think that a lot of times navigating the parenting styles and getting a deeper sense of generally where are we, how were we raised as children, and how is that impacting how we're now parenting. I just think there's so many pieces to parenting. So this is obviously one podcast, but this could be a whole series of episodes because there's so much to dive into, like with parenting. But I agree. I do think that, and even if we're going deeper, I think there's parents that as kids get older feel like they need to adjust their parenting styles, which might not come as naturally to them. Like, oh, I need to become more permissive because now my child's a teen. But again, research has found that no, authoritative parents are still just as effective as we get older. And we need to understand what that control looks like.
Yep. No, these are all great points. And like you said, this could be a whole series on parenting.
Yeah.
And different subtopics.
Exactly.
So this is just one aspect and
exactly.
kind of giving a broad overview. Mm-hmm. So in addition to the child kind of feeling lost and confused and alone in their feelings, kind of disrespectful to parents. Well, they are disrespectful. I see it in my office where they're like, the kids are almost sitting in a whole different place than their parents.
Right.
They don't open up as easily.
Mm-hmm.
Because the give and take and open communication and dynamic is not present.
Yeah.
This can be a child that's a little bit older that just doesn't have an open kind of give take. Parents don't even know how to talk to their child.
Yeah. Well, and think about it this way. If a child grew up with their parent more so uninvolved, right? Like whether that's physically or emotionally, there's a lack of trust that they have with a lot of individuals, right? So you have to think about that of even starting the treatment process, it might just be building trust with a child because of course they're not going to be willing to open up. And of course, that's why there's such slower treatment progress compared to maybe some other. So I think it's a lot of it is that lack of trust.
That's interesting. That's really interesting. And so we can see just listening to you describe this, how you can't just drop your kid off in therapy.
Yeah, exactly.
And hope for the best.
Yeah.
That if you come to us and these are some things that we're seeing, we want to take your hand and say, hey, let's talk about this.
Yeah.
And I would say the families I work with, when we really get it down in the trenches, as I call with parenting, that's what they tell me, that the thing that changed the most for them is how their relationship changed with their child.
Mm-hmm. Yeah.
And so it's not fix my kid. It's, hey, how can we work together as a team?
Yeah.
That whole person approach, not just cure my kid, make him talk, get him to talk in school. It's all I want. And we get calls like that. I want my kid to talk in school, but whoa. Give me an IEP. Give me a 504. What do I do? It's like, whoa, step back, Jack. Like, we got to kind of figure this out.
Yeah.
And as we're doing selective mutism evaluations for families, we're kind of starting to pick up on parenting. We see it in session and we are very constructive and we're very supportive. And that's how all these therapists that are working with kids need to be. But parents that are listening to this and therapists that are listening to this piece is so huge in this population.
Yeah. And I would say, even when we think about, we're talking about parenting, but when we think about these 4 styles, right? And we think about those ingredients of like control and warmth, is that as therapists, we also model that with our families, right? Like when I'm working with families, I'm also always thinking about how can I provide structure, routine, predictability? Like how can I give them that control, right? I provide control, but I also provide a lot of warmth in my sessions and I listen to parents and I talk to them. So I'm modeling that for them so that they see and that they feel, wow, I see why this is so effective, right? Like I understand, like I go into sessions with Dr. Jenna and it's like, okay, we're doing this, this, and this. But then also, of course, if there's a time where this goal didn't work or this game didn't work, we talk through it and she's giving me that like helping hand. So I model that a lot in my sessions because I want parents to see what their kids might be feeling.
Yep, exactly. Yeah. And when you see some kind of what I call maladaptive stuff going on in session, we might gently talk to the parent, say, hey, I know when you were talking to Rebecca, for example, this is what happened and this came up because you're frustrated. I can see that. Let's talk about how we could have done that differently.
Right.
And then all of a sudden you see the parent like get these aha moments in session. Wow, that makes sense. And I can see how at home when I'm doing X, Y, and Z, maybe I wasn't handling it. And I'm like, look, don't beat yourself up.
Yeah.
The reason you're here is we can work together to help you see these things and help you really parent. And they're usually just so appreciative. They come so open.
Definitely.
But to get back to this, the uninvolved, because I mean, we keep going off on these tangents, a podcast on each of these parenting styles.
Oh yeah, for sure.
And possibly that's what we do.
Yeah, this is just kind of like a general sense, but I think this is really helpful.
So that with the child that doesn't open up, and we're talking about the need for trust and that kind of open communication, and that dynamic isn't present, the child lacks, again, similar to the permissive parent, in the permissive parenting style, that motivation for change. Why change or try?
Yeah,
like, who cares? Nobody cares. Like,
exactly.
It doesn't really matter. Whereas the permissive parent, I can do what I want. It's no big deal.
Right.
Like, mom won't, it's a no big deal. So they kind of present on the surface, permissive and uninvolved, somewhat similar in their response to treatment. I know the parenting's different. So again, that child feels completely out of control.
Right.
And it's a slower treatment process.
Right. But it's interesting because those are two of the parenting styles where there's such low control. So it's interesting that those are the two parenting styles that we find where the child feels the most out of control. We'll obviously talk about authoritarian right now, but I do find that those are the two types of parenting where a child's feeling so out of control because there's no control and there's either only warmth, which is permissive, or just neither for uninvolved.
For the authoritarian parenting, which again, my way or the highway, it's 9 o'clock, time for bed, you got to eat the chicken and the pasta. The child feels small. They feel unimportant. They feel abandoned. They feel that they don't matter as much. They lack a lot of self-confidence.
Yeah.
And the child feels, again, disrespected and very controlled.
Yeah.
And you sometimes just see this child just kind of get small around their parents. When they're younger, they retreat. When they're older, they become defiant and rebellious.
Yeah.
And the child avoids treatment. They avoid goals because they're almost afraid to take a risk because of getting criticized or judged.
Right.
It seems uninvolved due to the fear of making those mistakes because of the parent being so overly controlling and involved.
Exactly.
What do you have to say?
Or it could be a child that does the goals, right? Because it's almost like, well, I have to do them because dad is staring me down and like he's telling me I have to do them. But then this might be a child that in treatment, when we think about like a feelings chart, right? Like let's say like a 5's when things feel really scary and a 0's when things feel really, really comfortable for us and good. This might be a child that constantly is feeling in that 5 out of 5. Like this feels really, really scary. And so we're not navigating those feelings with the child and we're not talking through those things. So they're constantly feeling all the time this high anxiety because they're still doing it, which is maybe what we're supposed to be doing, but they're not working through the understanding of how to get through.
Would you say that perfectionistic nature of a child when they're so overly a perfectionist could be related to parenting style? What are you feeling with that? Like in terms of having an authoritarian parent and a child being a perfectionist to the nth degree perfectionist?
It could be. I think that could be definitely something to further explore. I think parenting is like
I got to get it right because mom wants this, dad wants that.
I think there's, I mean, that's like a whole other topic because I think there's definitely individuals that have specific temperaments. And I think perfectionism is definitely like part of like just our temperament of like, we just might have been that type of person.
Yeah.
But I also think definitely parenting styles can impact the way that we perceive the world, which could include perfectionism. Perfectionism is a whole other topic because we see so much.
Jenna.
Yeah, we see so much perfectionism in our treatment and specifically at camp. We talk about it a lot as we're talking to the parents. So I do think that could be something to explore.
Yeah, I mean, I would say that it's not as uncommon as people think with it. Yes, you can be kind of, especially like you said, temperament.
Yeah.
But I also see in my very authoritarian parents, children being almost afraid to take a risk because they're afraid they're going to make a mistake. But if they do, they work so much harder because they're afraid to make a mistake.
Yeah, definitely.
So you see those two sides of I'm not going to bother and they seem uninvolved.
Definitely.
And they're afraid to take a risk because of fear.
Right.
But then so you see that.
Yeah.
And again, treatment is slower.
Yeah. Well, and also think about it. The permissive and uninvolved parents are the individuals that provide no control. So the child doesn't really need to become a perfectionist because, they could just do what they want. Right. Versus an authoritarian is a parenting style that has so much control, but no emotional kind of, or like no warmth, very, very little warmth. So these could be kids, yeah, like you said, that need to build some type of control because they don't have any. Right, so that could be in their perfectionism.
So let's talk about authoritative parenting, and we probably will have a part 2 in terms of how to be a more authoritative parent, which I think is awesome.
Yeah, we could definitely do a part 2.
Let's just sum up the authoritative parenting once again, Jenna.
Yeah, so authoritative parents are parents that have an equal amount of high control and high warmth. So this is a parent that provides both that structure, consistency, predictability. There's routine, there's rules that kind of go within the household, but they're also providing a lot of warmth and affection and allowing their child to, let's talk about it. Like, let's go through that together.
So I often describe it as choices with boundaries.
Exactly. So it's like what we talked about with even eating. It's like, okay, this is what we're having for dinner, but do you want the chicken nuggets, the chicken thighs, or like the chicken wings, right? Like, so you're giving them the boundary of like, we're having chicken, but why don't you choose the chicken that you want?
Or bedtime. Bedtime's 9:00. We can read longer, or you can take a longer shower, but we can't do both.
Right.
Or you didn't pick up your toys, or what, you were fooling around with your brother and kind of fighting downstairs and having a great time. So we missed out on that kind of time. Bedtime's 9:00. So you're letting them understand the repercussions of that routine, but you're not bending too much on the 9:00 or 9:05, because then you become, oh, no big deal. And then you start moving. And sometimes parents will say, gosh, it's not worth it. Life is crazy. I've got 4 kids. Everything's happening. Sometimes it's easier just to let them go to bed when they want.
Yeah.
And maybe in that area, you've let go because the child on their own realizes as they get older, I feel better going to bed at 9:00 or 10:00 instead of staying up till 11. So again, one of the things you said during this podcast is, you do let up on some of these kind of rules and regulations, so to speak, and control, especially as the child ages. It changes. You're going to be different with a 3 or 4 or 5-year-old than you are with a 15, 16, or 17-year-old.
Exactly.
So I think it's important to understand how they present in treatment, that structure, consistency, routine, and predictability. We've said it probably 15 times, but it's so critical. And we teach parents how to do that through schedules and charting and knowing what, when, and where, and things like that, and how to parent. But the child feels in control and safe, Jenna. They feel that sense of like security. The child opens up, discusses. It's more of an open dialogue.
Right.
They're more responsive to the parents' help and involvement. They're not as like resistant to it because they feel respected.
Exactly.
And
they're part of that process.
Yeah. They're willing to take risks and understand it's okay to make mistakes. They're happier and more confident kids, for sure.
Yeah. And they're willing to take risks because they know that mom and dad would be there to kind of help navigate that process when I do take a risk.
And as they grow, they tend to make better decisions. They're more independent. I can try this. I think I can do this.
Yeah.
You see that in treatment, and they have a much quicker treatment because of all of these critical aspects of parenting that are there. So when a parent says, how long will this take? I can't answer that without knowing you.
Exactly. And knowing your child, of course, again, every kid's different.
When I say you, I mean your family.
Yeah.
Without understanding your child, their unique needs, their whys, their stages, and how you parent, and all the parenting stuff going on.
Yep.
And your world. And once we know all that, and assuming implementation, facilitation is there with goals and strategies, the school has the accommodations, interventions, you're doing your goals, you're doing your games, the child will do quite well. And it's amazing. I can have a more shut down, less communicative child make a ton more progress quicker than a child that even comes in minimally verbal, because these other ingredients that are needed for successful treatment are there.
Exactly.
That's why it's not about how severe in your mind you're seeing, or how the child isn't on the bridge in any sort of communicative way, pretty shut down. I can have a more shut down child have quicker treatment. So it's very, very interesting. So this has been amazing.
Yeah.
Talking about this. And then we're going to do our next podcast on how to become a more authoritative parent, and how do we deal with families where one parent is one type of parenting and another parent is a different type of parenting. not only how confusing that is for a child, but how do we work together? And some families might go, I'm here, their father or mother isn't here. And that's also hard because we do need whoever's parenting that child on a regular basis to be involved in this because of the mixed messages these kids could get and how that does affect successful treatment.
Yeah, definitely.
Any last minute thoughts?
No, I think this is definitely something that could be a continued conversation. I appreciate you having me on the podcast. And I know that parenting is something that is a high interest of mine. I know it's something that a lot of parents have been asking for. So I hope this was very helpful to the listeners. And we're looking forward to continuing this conversation.
Jenna, you are always welcome on podcasts. And this is a dream come true for me. And our listeners know that you're here full time now. And I'm in Hawaii. Kidding, listeners. I keep saying that. But I am super excited because our families can continue to benefit from your wisdom and your gifts. And thank you so much for being on this podcast. It's really awesome. And I definitely want to talk about in our next podcast, what got you so interested in parenting? That always has been such an interest to you. So that would be cool to just kind of talk about it because I also am very passionate about that parenting aspect. So this is just really awesome. So thank you.
Thank you so much.
Have a great day, everyone.
Bye.